Today we are going to tell you about chickenpox. Chickenpox is a viral infection that causes an itchy rash of spots all over the body and flu-like symptoms. It used to be a common childhood illness in the United States, especially in kids under age 12. It's much rarer now thanks to the varicella vaccine that kids get when they're 12 to 15 months old, followed by a booster shot at 4 to 6 years of age. Chickenpox often starts without the classic rash with a fever, headache, sore throat, or stomach ache. These symptoms may last for a few days with the fever in the 101 to 102 degrees Fahrenheit range. The red itchy scratch rash usually starts on the abdomen or back and face, then spreads to almost everywhere else on the body, including the scalp, mouth, arms, legs, etc. The rash begins as many small red bumps that look like pimples or insect bites. They appear in waves over 2 to 4 days, then develop into thin-walled blisters filled with fluid. The blister walls break, leaving open sores which finally crust over to become dry brown scabs. All three stages of the chickenpox rash, red bumps, blisters, and scabs, appear on the body at the same time. The rash may spread wider or be more severe in kids who have weak immune systems or skin diseases like eczema. Chickenpox is caused by the varicella zoster virus, also known as VZV. This virus also causes a painful skin rash called shingles, the herpes zoster, later in life. After someone has had chickenpox, the virus stays dormant or sleeping in the nervous system for the rest of his or her life, even though the chickenpox goes away. The virus can reactivate or wake up later as shingles. Chickenpox is very contagious. Most kids with a sibling who are infected also will get it if they haven't already had the disease or the vaccine, showing symptoms about 2 weeks after the first child does. The chickenpox virus spreads both through the air by coughing and sneezing, and by direct contact with mucus or saliva or fluid from the blisters. Chickenpox is contagious from about 2 days before the rash starts until all the blisters are crusted over. Someone with shingles can spread chickenpox, but not shingles to people who haven't previously had chickenpox or the vaccine. Shingles can only develop in people who have already had chickenpox. Some people are more at risk for complications from chickenpox, including pregnant women, newborns born to mothers who had chickenpox, patients with leukemia, kids receiving drugs that suppress the immune system, or anyone with immune system problems. Yes, the chickenpox vaccine is 99% effective at preventing the infection in kids. Doctors recommend that kids get the chickenpox vaccine as a first injection when they are 12 to 15 months old, a booster shot when they're 4 to 6 years old. People 13 years of age or older who have never had chickenpox and aren't vaccinated should get 2 doses of the vaccine at least 28 days apart to be protected. Few people who have been vaccinated actually develop chickenpox, and those who do tend to have very mild cases and recover quickly. A virus causes chickenpox, so antibiotics can't treat it. But sometimes antibiotics are needed if bacteria infects the sores. This is common in kids because they scratch and pick the blisters. An antiviral medicine might be prescribed for people with chickenpox who are at risk for complications. The decision to use this will depend on a child's age and health, the extent of the infection, and the timing of the treatment. Your doctor can tell you if the medicine is right for your child. Never give aspirin to kids with chickenpox. Such use has been linked to rare but serious diseases, Reyes syndrome, which can be leading to liver failure and even death. Cool or lukewarm baths, not too hot or too cold, with 2 cups of ground oatmeal blended in. Use home ground oatmeal or a store-bought oatmeal bath packet like Aveeno. That can help reduce itching in children with chickenpox. Adding 1/2 to 1 cup of baking soda to the bath may also halt to the itches. Give your child a bath frequently, every 3 to 4 hours for the first days of the virus. The person with chickenpox is contagious from the beginning of the illness up to 2 days before the spots appear until about 5 days after the first spots appear. So long as there are no new blisters or moist crust on spots, the person will not be contagious, even if there are still crusts on the skin. Thank you for watching this episode of Adventurous Kids.